Okay, today I'm doing a recording on this gentleman treating his back problems. Okay, and I will use Twitter and cupping, and I'll show you how to work with cupping. Okay, and work on his back. Okay. This is the second session of the cupping, and previously we have quite a few sessions, probably five or six sessions on Turner. The symptoms getting better and better, so I will let him talk to you about his problems. Okay, now I'm going to ask him. Those problems may be benefit to you. The question may be benefit to the students. Okay. How long you have this pain on your back?
Well, I've had the pain on my back prior to meeting you about 90 days to 120 days. It was intermittent in the beginning, and then it became more constant and consistent with the pain. Before I met Tim, I brought this problem to my general practitioner, which is a good physician in his field, but he basically recommended muscle relaxers and pain medication to alleviate the pain, and hopefully this would somehow go away. The second stop I made was at a chiropractor, and I probably saw him for 9 or 10 sessions. I would get immediate relief for a couple hours, and then the pain would come back and it would be normal again, and I would have that ongoing pain. The pain in my back was more in my rhomboid shoulder blade area, and I dismissed it as poor posture and driving habits and bad sleeping habits and things like that, but I've been doing that for years, so I don't know of anything else that had changed. I felt like I was pretty much without any other options. My wife was kind enough to do the research and found Tim, and I took a stab at it and said, I'm going to give this a try. It has to be something to it. So on the first appointment, there was a lot of pain in my back in other areas that I didn't realize that he located and helped eliminate some of those areas. And as he mentioned a moment ago, through the treatments over the last half a dozen, 6 or 7 sessions, including one cupping session, the pain has gone away, and it comes back infrequently. But I believe, the best way that it was explained to me was Tim said that it was a lack of energy and blood flow to the nerve area. Where the chiropractor, for example, adjusted me and I felt an immediate relief, I assume that's because it created blood flow immediately. It got some type of energy in that area because that's where he was cracking me. And it was okay for a little while. And then maybe 2.5, 3 hours later, that pain started coming back up. So I have high hopes, and I'm very positive that we're going to be able to eliminate this. So we're going to try a cupping session today.
Okay, I'll ask you again. How did those pain affect you on your back?
Oh, well, it's debilitating because it's all you can think about when you're in that constant stabbing pain. You really can't work properly. It's hard to sleep. You have broken sleep when you do sleep, which makes you irritable, hard to be around your family, coworkers. It's tough.
So, is it constant pain or just come and go during the day?
Now it's
constantly.
Now it's not constant.
Before you come to me,
before it was more constant. There were moments that I had some relief, or maybe I was just getting used to the pain. And it wasn't as bad, but it did have spikes of pain.
Yeah. Okay. Now I'm going to explain to you what I think about this syndrome. pain on the back basically is over the back. Yeah, he confirmed to me that all those muscle under the arm and moving to the rib cage from the top of the shoulder blade down to the back. Is that right?
Yeah.
Now this kind of symptom is very common. Doctor would diagnose as fibromyalgia. Yeah, something like that. Yeah, because it's they have no understand what causing that and what exactly it is. The fibromyalgia basically it means sensitive nerve. Okay. Now, what causing sensitive nerve? They probably don't know, or maybe they know. And I'll tell you what causing sensitive nerve is lack of blood supply. So my diagnosis for this symptom for this gentleman is what we call energy stagnation. It's not because his lack of energy, but those muscles has blocked the energy movements. So the blood will not moving to those muscles as it required to aid the nerve. Now the nerve without the blood is raw, sensitive. Okay, that's basically why we feel pain. Is the nerve don't have much blood supply to nourish it. Okay, so when the blood is present, the nerve will feel normal. When the blood is absent, will feel sensitive. That's what happened to him. Now, what causing the blood and energy stagnation? There are several reasons. The prime reason is overuse the body, overuse those muscles, training, sportsmen, but or workmen constantly using the arm muscle, the body muscles. But some people, a lot of women, they don't do much exercise or they don't do a lot of sport, do have that kind of conditions. Now, how's that come about? They're not even doing much physical work. How the muscle become block the energy is basically another form of causing this kind of energy stagnation is a long-term exposure to the cold and can be inherited from our parents. Now remember, decade ago, women usually use lower top or expose the shoulder. It's the fashions. But this day is not very often to see that, except you go to party or ball in a public function. You may see women still wearing those low cut, expose the back. So come rain or come shine, or winter or summer, they still wearing those dresses just because it looks so sexy. Okay, now that create a problem when the cold invaded the body, penetrate to the nerve system, to the blood and to the muscle. So when you're young, it doesn't bother you that much because when we are young, we are full of energy, and we do move around a lot. But if it happened that way, the muscle have blocked the energy is because of the invasion of cold. So it will appear when we're getting older, when the energy decline. So all those hidden problems will come alive to haunt us. So some women in their late 30 or 40 or 50 or even older will experience those pain at the back, stiffness and constant pain when the nerve don't have enough blood supplies or energy supplies, it have a range of different feelings. Stabbing pain and numbness and aching pain, cold pain. So person to person, what they experience the pain. So this is how it creates the back problem, or doctor will tell you have fibromyalgia. Okay. Now medication won't work. Painkiller won't work. It may temporary for a few hours to stop the pain, but it's not trying to work on the root of the problems, to eliminate the root of the problem. At the moment, Turner, what I'm practicing, is still the best to eliminate those problems, promote the energy, promote the blood supply. You can forget about the chiropractor readjustment. It doesn't tackle the root of the problem at all. It won't promote the energy flow and blood supply. So later on, I will show you in two sessions. The first one is using the Turner. Now Turner is my Turner is one of my own. I create that. You may see some other Turner practitioner how they work on the body, but this is one of my own. You may not seen it before. Okay, you may seen some of my previous students using it. So the second part is using the cupping. Now cupping you don't have to use too often. Cupping basically is a folk medicine, but now it's more popular internationally. The cupping is to exchange the blood, move the blood around, and relive the blood. So also to mobilize the energy channels on the back there, so it can be smooth, running up and down the body. And so that's what I'm going to show you in a minute. Okay. Are you ready?
I'm ready.
Okay. Let's go to my treatment room.